Hello and welcome. Happy Thursday. It's Thursday, February 22nd, and we are reporting from, my name is Gerald Major from the Canadian Spondylitis Association, and we're reporting here from the Arthritis Broadcast Network, hashtag CRA Arthritis, mouthful. I'm here today with Dr. Marianne Fitzcharles, and we're going to talk about a very popular topic these days, medical cannabis. So I'd like you to kind of just give an introduction of yourself and why you're here in rheumatology, and then we'll get into some cannabis conversation. Thank you.
Morning. Thank you, Gerald, for the invitation, and good morning to everyone out there from sunny Vancouver today. I'm a clinical rheumatologist. I am at McGill University. I've been there for over 30 years. I am a rheumatologist that straddles two specialties, both rheumatology and chronic pain. So in addition to being a rheumatologist in Canada, I am a pain medicine specialist as well. And in this context, we know that patients with rheumatic diseases do have ongoing persistent pain, even when the rheumatic disease, such as rheumatoid arthritis or even ankylosing spondylitis, is very well controlled. Pain persists, and we know that probably more than 50% of patients with well-controlled inflammatory disease have daily ongoing pain. And I think this is one of the reasons why we are here today to talk about pain management in rheumatic conditions.
So maybe a little bit of background about me. I am a medical cannabis user, and I've used it successfully over the years to reduce opioid prescription, among other things, and I find that it generally helps with me from pain perspective, sleep, and appetite, and a little bit of mood, so I'm in a better position to kind of handle my pain. So what are you seeing out there, and what are you bringing to the CRA this year with respect to that?
Right. So clearly we're going to be talking this morning about medical cannabis. Let's start off by saying that we do have a cannabinoid system in our bodies, and this has been well described, and we know that the cannabinoid system in the body essentially calms the person. It brings us back to equilibrium. And exactly as you have noted, the cannabinoid system promotes sleep, promotes relaxation, promotes appetite, and also has impact upon pain and inflammation. We have a number of cannabinoids that are available. There are the pharmaceutical cannabinoids, which are obtained via prescription, and there is the herbal product, which is herbal cannabis, which is very, very topical in Canada at the present time. So medical cannabis has been available in Canada for a number of years. It's available via prescription, and we anticipate that in the next few months, recreational cannabis is going to be available in Canada as well. We know that somewhere in the order of about 300,000 Canadians are currently using medical cannabis to treat various ailments. We also know that musculoskeletal complaints are one of the most important reasons why persons access medical cannabis. You're going to say, why is this agent being used so commonly? Well, I think the bottom line is that the medications that we have available today to treat pain are not terribly effective. And unfortunately, they cause a lot of side effects. So we have a few categories of medications, starting off with the very simple analgesics, such as acetaminophen. Then we move up to the anti-inflammatories. And then finally, the third group is the opioid category of medications. And we know about all the terrible problems related to opioid use. We have on the side some other agents, which we call adjuvant agents. These include some of the antidepressants, antidepressant agents, which have pain modulating effects, and we also have some of the anticonvulsant medications. But the cannabinoids have now moved into the arena, particularly of pain management. We're seeing many, many patients using cannabinoids, but as an academic and as a clinical researcher, I have to bring to the table the fact that the current state of the evidence is unfortunately lacking. And in fact, not sufficient studies have been done to give us strong evidence that cannabinoids are good for the management of pain. And you're going to say to me, well, why? Why don't we have this evidence? And the reason is because cannabis and medical cannabis has been a controlled substance. And it's been very, very difficult for researchers anywhere to access the product, to do a good study. So we just don't have many, in fact, in rheumatic diseases, we do not have a single study looking at herbal cannabis in any rheumatic disease. So the evidence is lacking. Our patients tell us it's good.
Yet most people using cannabis, there was a period of time where it was about 60% are using it to treat the symptoms from arthritis. So I want to thank you and commend you for yesterday's presentation because we get to the, and this is my next question, of what do you do when there's no research, but you have real-world evidence and you're talking to patients and you're seeing that it's having an effect.
Right. And as I mentioned yesterday, medical cannabis is here to stay. There is no question. And I think as researchers and academics, we've got to gather the information as fast as possible that we're able to competently advise our patients regarding the benefits and the risks. And just simply extrapolating risks from persons who are using cannabis as a recreational product is not appropriate to our patients with rheumatic diseases, because a patient is someone very different from someone who is accessing the product for recreational use. We've got to take into account many different factors when we are treating a patient. Patients are on many medications often. Patients might have what we call comorbid diseases, so there might be other factors, which is very different from a 27-year-old sitting on a Friday night and having a few joints with his friends.
So just around that, a little bit of my story. I've been diagnosed with ankylosing spondylitis and psoriatic arthritis, and then I've got a multitude of comorbidities. And I find the one that I really need to be careful and balance, because cannabis is so unique and so unique and can treat many different things. I run into issues when, if I'm trying to treat my pain, but I'm in kind of an anxiety flare or a mood disorder or a depression, I need to be really careful about which type I'm using. So to the point around, we're really looking for a unique and separate medical system within Canada, and do you believe that's where we're headed?
I sincerely hope that we will have a two-track process, that medicinal cannabis will have its own single track, which will be very different from recreational cannabis. And I think you've raised a very important point, and that is what we're beginning to call PRO, patient-reported outcomes. And the person with a disease is probably the best judge of his or her own current status. And we've also alluded to the very, very complex situation of cannabinoids. Because although I said in the beginning that we believe that the cannabinoid system just calms the system, puts us back into equilibrium, it's not quite as simple as that. And we know that there are times when a cannabis can increase anxiety and can reduce anxiety. There even is current suggestion that similar to the opioids that can induce what we call hypersensitization or opioid-induced hyperalgesia, there might be a concept that cannabis on its own can also induce pain as opposed to calming down pain. So this system is very, very complex, and it certainly is not a matter of one size fits all. And this is our challenge at the present time, because we have many, many different cannabinoid preparations available, different levels of the two important molecules, THC, tetrahydrocannabinol, and cannabidiol, CBD, and which concentration of each molecule is important for which condition. This all needs to be worked out.
Yeah, I mean, it's very complex, a lot of work to do, I mean, a ton of research. Where do you think we'll be in 10 years?
I hope we'll have some good, solid clinical evidence. As an academic, as a researcher, we really know that our clinical management is driven by evidence. And I hope that we will have some answers to the questions that we are grappling with today. But as I've said so often, we need to protect our patients, we need to protect society as well, and do everything we can to have less harm. And in this context, I anticipate that the Canadian Rheumatology Association is going to be developing a consensus statement to help guide both rheumatologists as well as our patients regarding the use of herbal cannabis.
So that's groundbreaking information, isn't it, right now? I mean, as a patient, how impressed I am with the rheumatology community, with organizations like the Arthritis Society, and people like yourself that have recognized that cannabis is here to stay. People are using it, and we better catch up, and we better put some effort on this. So you heard it here first. Coming to your local community through the CRA is some work on cannabis and the benefits, as well as what to watch for. Do we have any questions from outside?
Yes, we have two questions. The first one, how do we tell which published research studies out there are credible?
So the question is, how do we tell which published research studies are credible? That's a very, very good question. And I might preface it by telling you that everything that's published, even in the recognized medical publications, are not necessarily absolutely perfect. And we have systematic reviews looking at various treatments with cannabinoids. And in fact, some of the systematic reviews, which we believe is one of the highest levels of evidence, when we really analyze them, are not terribly good. So I think, first of all, one needs to look at where is the publication published, where's the manuscript published? Is it in a high-quality journal? That's sort of the first step. Number two, we really look still to randomized controlled trials to give us information. The lowest level of medical evidence is what we call anecdote, which is what people say. And in fact, what people say is also very, very important. And I might let you know about Lyme disease. Lyme disease, the first time it was identified and brought to attention was a group of mothers in an area where children seemed to have had the same disease. So this was anecdote that moved Lyme disease into the true medical arena. So anecdote we mustn't discount completely, but we must move it beyond anecdote.
And the second question, I guess, could be for both Gerald and Marianne. How do you tell which medical cannabis providers are credible?
Well, I mean, there's an organization that I work for, CFAM, Canadians for Fair Access to Medical Marijuana. I think that you can go on there and really kind of check regarding, I think we just last looked, there's about 90 registered licensed producers. What I can say is that they're all held to very high standards. Testing is frequent. And because of the complexity and the uniqueness of cannabis, it may take a couple different tries to find out what really works for you. So there's lots of information and boards out there on cannabis within Facebook or Twitter that people post these types of questions and get lots of information back. I've had success with quite a few of them personally, and I mean, I think it goes down to preferential choice and what works with budget. There's certain LPs out there that give better discounts to people with low incomes. As you know, we're still paying tax on cannabis, and we're still paying for it. It's not part of the formulary, but hopefully with the good work of people like yourself and others, we'll get there eventually. I'm not sure if you have any comments on the...
I think the one thing that you said, which is important, licensed producers. So licensed producers have to achieve a certain standard of production. And I think a licensed producer is certainly going to be more reliable than going to the street corner.
I mean, unfortunately, at this present time, I mean, all we have is a lot of trial and error from patients, really, to go out and try things and see what works. And that's why there's such a need for research and a call for research money for this.
Could I ask you a personal
Sure.
question?
Absolutely.
And I think this might be helpful for people out there. How do you use your cannabis? Do you smoke it? Do you use an oil? Can you tell us the difference in your personal experience?
Yeah, so I mean, I have a couple of things that probably will resonate with some people. I'm 4 weeks out of a reverse shoulder replacement this year, so I had that 4 weeks ago, and my surgery last year was on my foot. And what I did, instead of increasing my opioid use, I increased my cannabis use. And what I found that through surgeries, sleep is very important. And regardless, we'll kind of get to the ankylosing spondylitis sleep question, but I find that if I can get to sleep, I can stay asleep. So I use oils, high THC oils at night, and that works with sleep. It works with pain great. I don't necessarily like to feel that way all through the day, all the time, and I have to be active, and I need to drive and be responsible. So
let me interrupt. How do you, when you use an oil at night, how do you feel in the morning when you wake up?
I feel much better than I felt when I was taking sleeping pills, that's for sure. I feel fresh. I mean, I have underlying fatigue issues, and multiple comorbidities within the spondyloarthritis family. So I haven't felt fantastic in the morning for a long time, but I certainly don't feel groggy. I tried sleeping pills for probably just under a year, and I didn't really respond to them very well. And I found cannabis was a great substitute for that.
Do you ever smoke it?
I've smoked it on occasion. Yeah, I tried to mostly vape, and I want to just get into an oil regime.
Can you tell us the difference between smoking and vaping, you personally? What does it feel like?
So smoking is certainly not something that we want to recommend for people, but some of us, including myself, I'm 46 now, and I grew up in the age of reefer madness a bit, and so that's more of a bit of a habit. So let's not even talk about the smoking part of it. Let's go right to
the medicinal effect. Do you notice? Can you tell us? Is there a difference between smoking, vaping, and taking the oil?
I think between smoking and vaping, definitely from a vaping perspective, it's very clean. I find that I actually get more benefit from vaping than I do from smoking.
Do you taste it when you vape?
The taste of it is incredible from vaping, from
it's
from
good
smoking.
or bad?
Very good, very good. I mean, it's really so much about consuming cannabis can be, I mean, we're patients, but some of us can be recreational. It's like having fatigue, but also being a bit lazy at the same time. So I find that, you know, just from a vaping perspective, it's very immediate. You could also control it. So if it gets a bit too much, then you can eat something and kind of get rid of it. When you get into...
What do you mean gets too much?
Well, if it gets too... sometimes you can get lightheaded a little bit too much. I mean, these are the benefits, but then it can also be something like a side effect that may not be pleasant at certain times. So if I haven't eaten properly and I maybe used too much, or I've tried something different and it's a bit too strong, then a lot of people say it's kind of that green feeling. Some people have been on the bed and things are spinning. So you get that type of feeling, but when you consume it through vaporization or smoking, then you can quickly get rid of it by eating.
How quickly after you have vaped do you feel an effect?
So much of it is really kind of about the whole process, your mental state, the way things smell, the way things look, and then when you consume it, it's kind of that overall effect for me. So very quickly, I mean, within a couple puffs on a vaporizer,
So
you're
within
feeling,
a few
you're
minutes.
feeling my mood uplifts. It might not get rid of all my pain at the time. It may not instantly make me hungry, but certainly mood is great. And when walking around with chronic illness all the time is not always all that pleasant. So to feel nice and you know, hopeful and euphoric, I mean, it's actually a pleasant
Can
feeling.
I ask you to try and give us a number? So if you're experiencing pain, and again, we measure pain on a visual analog scale from 0 to 10. I want you to imagine yourself with, I'm sure you've experienced pain of 8 out of 10 post-surgery. What do you expect vaping to bring that pain down to?
So when I'm flaring, and quite often I can get to the 8-9 pain scale mark, those are the times when I will use an oil through the day with vaping on top of that. So I can bring my 8-9 down to a 6-5 very quickly. And then I talk about more the benefits of cannabis for me on mood rather than pain. I mean, for me, pain is always there. But if I can be in a better state of mind to kind of process my pain, it makes things that much better. So.
And can I put the cannabis next to the opioids and ask you to compare the difference?
Yeah, so opioids, very kind of sketchy, racy, almost the feeling sometimes of being a little bit too high. And from a cannabis perspective, I mean, for me, there's really no comparison. It's unfortunate that we're stuck in an environment these days where people need to choose. And sometimes, due to financial reasons, that choice isn't the best choice for them. I've decreased my opioid consumption in the last 2 years by about 70%. I'm pretty happy about that. Will I ever get to zero? I'm not sure. I'd hope to, but I think 70% in 2 years is fantastic. The unfortunate part, and I mean, lucky enough for myself, I can afford to do that. I worry about the people that can't. So if that's all the questions that you have, that was fantastic. I didn't expect to be interviewed like that. Anything else from outside? Okay, well, I have to ask for the ankylosing spondylitis community. I know that we spoke about a year ago at the Arthritis Society Pain Symposium, and you mentioned to me at the time that, you know, research should really start at ankylosing spondylitis. So
You're absolutely
kinda,
right.
I walked away from that, and then I kind of was scratching my head for a year saying, I wonder why she said that. When I saw you here, it was great that I could connect with you. So
You're
explain that a
absolutely
bit.
right. I think that as a physician and as a non-patient regarding ankylosing spondylitis, what I hear from my patients is that to have a wonderful night's sleep with ankylosing spondylitis is a gift.
Right.
And I think that if cannabinoids can give our patients that wonderful night's sleep that would be a great advantage.
Thank you so much for being here, and thank you for all the work that you do. The patient community, even outside of rheumatology and arthritis, thank you very much for what you do.
Thank you.